Hello, my name is Carly, and today I will be walking over the surgery research that I did. So, to start off, the standard treatment for lower back pain has been interbody fusion, which is transforaminal lumbar interbody fusion, or TLIF for short. And the invasive nature leads to muscle detachment and damaged nerves. So, to address these issues, minimally invasive TLIF techniques have been developed. However, these show decreased blood loss and complication rates relative to open TLIF, and surgery times and long-term outcomes are reported to be similar whether you use the minimally invasive route or not. So oblique lateral lumbar interbody fusion is a MI lumbar spinal fusion through a single 10 to 15 milliliter incision. And the good thing about this is that it has a faster surgery time and it's easier for surgeons to approach. So to test this, anesthesia, surgery times, and blood loss were recorded for all patients that entered into the EMR. And since no suction is used for OLLIF procedures, blood loss was measured by weighing sponges and subtracting dry weight. So to monetize the cost per minute for a hospital, a published reference was utilized and adjusted with the customer price indexes. So these values were reported in aggregate and stratified based on spinal levels of surgery. And U-tests were utilized to test the null hypothesis that the OLLIF and TLIF groups have the same or identical mean distributions for age, BMI, blood loss, and uncensored time duration variables. And data analysis was performed using IBM SPSS, and a shorter length of stay for OLLIF was found by about 58.5%. So 3 days versus 5 days, and a shorter stay correlated with a decrease in hospital bills, at least payment. And the trend of shorter stay lengths remained consistent when surgeries were stratified based on the spinal levels involved. And OLLIF also had a lower surgical admission cost, as I mentioned. And the difference between this was $6,000 versus about 11,000. And these findings suggest that OLLIF may have a cost-effective and efficient alternative to TLIF for treating lower back pain, um, particularly for hospitals with limited resources since patients are not staying as long. And yeah, thank you so much for watching.